Good morning and welcome back. Today we have Chief of Surgical Oncology for Atrium Health Navicent and Medical Director for Atrium Health Navicent Peyton Anderson Cancer Center, Dr. Paul Dale, joining us today. Thank you so much for being here, Paul.
Thank you for having me.
I'm glad to have you. October 1st is Breast Cancer Awareness Month. I see the pink you have on.
I do.
And so, although the color is lovely, it is a serious topic I want to talk about. And so first off, I want to talk about the importance of screening for breast cancer. Why is that so important, and what are the steps, if people have a little question in their mind to get tested, why should they be getting tested?
So the reason we should get tested is because any cancer, the earlier you find it, the better the chances are you're going to cure it. And especially with breast cancer, because we have a wonderful screening tool, and that is mammography. So every woman, when she reaches the age of 40, unless she's got a family history of breast cancer, perhaps she needs to start early. She should ask her primary care doctor that question. But every woman starting at age 40 should start her screening mammography. I would recommend yearly if they're on, and get the mammography done. And it's interesting, and sometimes now women will get their mammography back and it'll say they have dense breast tissue. And a lot of questions are coming up about that. All that means is that, especially in younger women, that their breasts are very dense, and it's not an unusual thing, but a new law has made the radiographers state that their breasts are dense. And if that's the case, the mammography may not pick up small tumors, so therefore additional screening tools may be necessary. And the neat thing is that we at Atrium have a special test called molecular breast imaging, MBI, and it allows us to detect even smaller tumors than we can detect utilizing our digital mammography. So if that's the case, speak with your primary care doctor and see if you might want to look at some of these advanced tests such as MRI or even the MBI that we're utilizing. We're one of the few centers around the entire state that has this advanced technology called molecular breast imaging. So it might be something, if you have dense breast tissue, that you might want to consider utilizing.
Wow, and so, there's a lot of stuff that goes into getting this testing done. What factor does genetics play into all of this when we're talking about breast cancer screening?
Great question. So a lot of ladies who get breast cancer, and that can be 1 in 8 who get invasive cancers, and if you consider the non-spreading type of cancer, 1 in 7 women are going to get breast cancers. And a majority of those won't have a genetic factor, but about 30% will. So it's important to consider, if you had a mother, if you had a grandmother or a sister, you might have a genetic factor that are predisposing you to get a breast cancer, and therefore having genetic testing done is very important. So if you have a strong family history, then you might want to talk to your primary care doctor and consider genetic testing. And we do that at our cancer center. We have special genetic counselors that allow you to get your blood drawn and get genetic counseling done. And nowadays you don't just test for 2 genes, the BRCA1 or BRCA2 that they used to do 10 and 20 years ago. Now we test up to 74, 75, 80 genes. It's a multi-gene panel that they're testing for not just breast cancers, but other cancers as well. So genetic testing and genetic counseling has come a long way, and it's very important, and that allows you to know that you're at increased risk for testing, say, for breast cancer or for colon cancer, or for men for prostate cancer. So having that knowledge, and it gives you the power to be tested.
All right. Now, if you want to learn more about Breast Cancer Awareness Month or events that are going to be put on through Atrium, we have those details on your screen right now. Mammo Marathon's coming up. We'll have all those details on our website, 41nbc.com. Thank you so much for being here today.
Thank you for having me. I appreciate it.
All right, to learn more about Breast Cancer Awareness Month, head on over to our website. Stay with us. We'll have one more weather check after the break. Stay with us.